afternoon, ma'am. I am Mr. Rose Andapalubos, your student nurse from St. Anthony's College. May I know your name and birthday, ma'am?
Maribel Cabayo, December 27, 1994.
Okay, Miss Cabayaw. So, sa kadyang adlaw, I will going to assess your peripheral vascular system. So, before that, I will going to gather all my appropriate equipments here. So, I have my gloves, stethoscope, my tourniquet, and then Doppler ultrasound probe, and my measuring tape. So, after introducing the equipments, I will going to put on your gloves. I will put on your gown, and then I will also going to wear my gloves as well. So before I will going to put on my gloves, I will wash my hands first with alcohol. So I will going to wear my gloves before starting. Okay, so I'm done wearing my gloves, so I will start with the arms. So I will inspect for the size, and then I will going to look or inspect for any presence of edema or venous patterning. So as I inspect for the arms, so the arms is symmetric of with minimal variation of shape and size, and then there's no presence of edema or venous patterning. So I will going to proceed with the inspecting for the skin color. So as I can see, the skin color is even, and the skin color is also the same. So I will going to inspect for the fingertips for clubbing. Okay. So as I inspect for fingertips, so there's no clubbing, there's no presence of clubbing. So I will going to palpate the fingers and hands and arms for the temperature using the dorsal surface of my fingers. So I will start here. Okay, so as I touch the skin, it is warm from fingertips to the arms. So I will going to determine for capillary refill time. So I will going to compress the nail bed here. Other hand, ma'am. So as I can see, the capillary beds are refill and color is returned on 2 seconds or less. So I will going to proceed with the palpating the radial. So as I palpate with the radial, it is strong. So I will going to proceed by palpating the ulnar. Okay, by palpating the ulnar, it is not detectable, so I will proceed with palpating the brachial pulse. So the brachial is strong, so I will going to palpate the epitoclear lymph nodes. So as I palpate the epitoclear lymph nodes, as I can feel, it's normally, and then it's it's strong, so I will going to perform the Allen test. Open your palm. Okay, can you please close? Open. Okay, as I can see, the pinkish or pink coloration returns to the palms within 3 to 5 seconds, as because of the ulnar artery is patent. Also with the pink coloration patterns or returns within 3 to 5 seconds because there is a radial artery is patent also. So after examining the upper extremities, I will going to proceed to the lower extremities. So I will going to inspect for the skin color of the leg. So I will going to remove the blanket. Okay. So as I can see, the color is the same. There's no changes of pigmentation. So I will going to proceed to the inspecting the distribution of hair. Okay, as I can see, the hair is covering the legs, and then it appears on the um, dorsal surface of the toes. So I'm going to inspect for the lesions or ulcers on the legs. So as I can see, there's no sign of any lesions or ulceration. So there's no presence of any lesions. So which is normal. So I'm going to palpate. I will going to inspect for the edema. So I'm going to use my measuring tape. So here's my measuring tape. So by measuring the edema, I will going to start off with measuring the mid-thigh. So I will going to measure also on the other side. Okay. So after that, I will going to measure the calf. And then above the ankle. Other side. And then lastly, the forefoot. Okay. So as I measure the mid-thigh, the calf, the above of the ankle, and then the forefoot, I can see that it is identical in size and there's no presence of swelling or atrophy. So I will going to palpate the edema. So there's no edema or what that is present on the leg. So I'm going to palpate the skin temperature. Also using the dorsal surface of my fingers. So as I touch the skin of the toes, feet, legs, it is equally warm. So I will going to proceed with palpating the superficial inguinal lymph nodes. So I will just cover it here with the so it is usually non-tender and then movable lymph, so which is very normal. So I'm going to proceed with palpating and auscultating for the femoral pulses. Femoral, I mean. So I will going to get my stethoscope. So first, I will going to palpate the femoral area, as well as I am going to listen or auscultate for the femoral surface. So the femoral pulses is strong and equal. So I didn't hear any sound when auscultating the femoral. So I will going to proceed with the palpating of popliteal. So that's a fine position first. Can you please balik ka di ka, ma'am? Okay, as I palpate the popliteal, it is not usual, difficult, or impossible to detect, and yet the circulation is normal. So I will proceed by palpating the dorsalis pedis. Okay, so as I palpate the dorsalis pedis, it is strong. So I will going to proceed by the posterior tibial. So there is the posterior tibial pulse. As I can feel, it is strong. So then I will going to proceed by inspecting for varicose and thrombophlebitis. So can you please stand up, ma'am? Tindig kita. So I will going to inspect for any varicose. So the veins are all flat, and then I don't see or seen under the surface of skin. I don't see any varicose or thrombophlebitis. So I will going to proceed by performing the position change test for arterial insufficiency. Igda, ikaw balik, ma'am. So I will going to elevate ang imo nga legs, ma'am, 90 degrees. Okay. So, ma-observe ko ang nag-appeal ang imo nga feet. So, I will go ano kita man papungko kita entangle natin ang inyong legs. Okay, as I observe, makita ko nga nagabaliktana into pink color. So, kay naka-sitting position and dangle ang legs. Ang pinkish colors ang nagbalik sa may tip kang toes in less than 10 seconds. Okay, so manual compression test kita. So, i-change natin ang position kang camera. Pwede ka katindag, ma'am. Talikod. So, i-compress ko rugya sa may vein part. Tapos, sa hand ko is i-place ko rugya 6 to 8 inches away from my other hand. So, i-compress ko yan deeply. So, as I perform the manual compression test, no pulsation is palpated. So, ma-proceed ako sa Tenderlandberg test. Ang higda ito, ma. So, i-elevate ko ang imong legs within 15 seconds. Ay, 15 seconds. And then, I will use my tourniquet para i-tie ang imong. Para i-tie ang imong thigh. Okay, so, hindag kita, ma'am. Okay, so na-tie ko. Within 15 seconds, ikuhaon ko na ang tourniquet. So, venous vein fills from below in 30 seconds. So, okay, ma'am. Kung ko ikaw sa, or higda ikaw sa imo comfortable position, okay, so mapungko na ikaw. So, kadya, ma'am, I will going to tell you the findings. So, sa may arms mo, tanan nga ano mo is normal. Ang skin color, tapos ang imo nga size kang imo nga hand and shape are all normal. It is symmetric. So, wala ako tin may nakita nga abnormal findings. Wala ako tin may makita nga mga edema or any lesions. So, it is normal. So, sa imo man nga legs, wala man ako tin may nakita nga difference like changes of pigmentations or any lesions or ulcerations. So, it is normal, ma'am. So, may pamangkot pa ikaw, ma'am?
Wala.
So, ako. Mahugas. Ani ako kalima. I will document all the findings. Thank you, ma'am. Salamat sa imong cooperation.